So in this video we will going to talk about the treatment and prevention of the influenza virus infection. So first of all, I should say that there is no cure that will surely exclude the influenza virus from your body. Okay, but there are treatments that will reduce the symptoms, that is known as supportive cares. This include rest, hydration and medication like analgesic, antipyretic and antihistamines. Okay, along with that antiviral medications are also available. Okay, so this includes amantadine, rimantadine. Rimantadine is also known as adamantins. These two medications are especially M2 ion channel tetramer inhibitor. Okay, so before going to talk about this, I want to recommend you that if you have not watched the detailed video that I have uploaded in the YouTube channel, that is on hemagglutinin, then I would like to recommend you to please go and watch it. Then it could be better for you in terms of understanding. Okay, because in that video, remember, I have told you that once the virus has entered in our body, it will be surrounded by endocytic vesicles, right? Now these endocytic vesicles will fuse with another thing, that is lysosome. Okay, this lysosome contains digestive enzymes and acidic interior, right? Most of the cases this digestive enzyme and acidic interior will destroy the contents that the host cell taken in, but here the case is quite different, because the acidic interior, that is nothing but protons. These protons will be helping the virus to start its uncoating process, because for releasing the viral genomic material inside the host cytoplasm, it is first necessary to uncoat, right? And this uncoating process is facilitated by the proton that is provided by the lysosome, right? Now this proton will be entering inside the virus via this M2 ion channel tetramer. Okay, now try to think about this. If we somehow block this M2 ion channel tetramer, then can those protons enters inside the virus? No, and as a result the uncoating process will be inhibited, and as a result the virus cannot release its genomic material in the host cytoplasm. Okay, that means the entire process of the virus infection will be stopped there. Okay, and that is the thing, how amantadine and rimantadine, that is also known as adamantins, can stop virus infection. Not only that, there are also zanamivir and oseltamivir, who are neuraminidase tetramer inhibitor. Okay, so now how they will do their job. So zanamivir, also known as relenza, and oseltamivir, also known as Tamiflu. So in the function of neuraminidase, we have discussed that neuraminidase play an important role in the release of the virus from the infected cell, okay, after budding from the host cell's plasma membrane, right? And how they doing this? They're doing this by cleaving the sialic acid, right? So if neuraminidase gets inhibited, so there is nothing present in virus that have the ability to cleave the sialic acid, and as a result the virus will be entrapped inside the cell that it has infected. Okay, that not only stops the viral infection, but it also reduces the spread and also reduces the duration of the disease. Okay, so that is how zanamivir and oseltamivir protect us from influenza infection. Okay, by trapping the virus inside the cell that it has already infected. Along with paramivir are also there. Okay, so remember, amantadine and rimantadine cannot allow virus to infect the cell, and zanamivir and oseltamivir prevent further spreading of the virus and also reduces the duration of the disease. Okay, now those antiviral drugs should be added or should be prescribed for the persons who at high risk of developing complication or those who are with already developed severe or complicated disease, and for hospitalized patient as soon as possible. Okay, so again, the patient who are at high risk of developing complication or those patients who have already developed severe or complicated disease, and for patients who are hospitalized. Okay, in such cases this kind of drugs are recommended as soon as possible. Okay, so this is the treatment part. Now we can use vaccination as a prevention. Okay, since the late 1940s the inactivated vaccine has been used as a prevention from influenza virus infection. Okay, vaccination is especially important for patients who have developed chronic illness due to some other medical complication, and as a result their immune system is already weakened, right? So they should be vaccinated, along with people who are over age of 65. Okay, and residents of nursing home and healthcare workers are at risk, right, because they are at close contact with sick people or infected people. Okay, so we should apply vaccinations to this group of persons, because if unfortunately some of them can develop the disease, then the clinical disease will be severe. Okay, that will not create a problem in their own life but also to their families. Okay, so that is why people who have developed chronic illness, people who are over age of 65, and people who are the residents of nursing homes and healthcare workers who are at close contact with influenza patient should be vaccinated. Now this vaccination process is not that much easy, because in the first video lecture where we have talked about the structure of the influenza virus, we have told you that influenza virus consists of 8 negative sense RNA genome, right? Not only that, then in the antigenic drift and antigenic shift video lecture we have talked about that a most important characteristics of influenza virus is genetic plasticity, right? That is, their genomic content will undergo point mutation and genetic reassortment. Okay, that is why their genomic content changes annually. Okay, not only that, this genetic changes leads to the formation of new subtype of virus. Okay, that is why the vaccine developers should updates their vaccines every year. Okay, every year they try to incorporate a new virus subtype into the vaccines. Okay, so that is why annual immunization is mostly important. Okay, even if in some years, let's say, there is no new subtypes available, still annual immunization is recommended, because remember, the immunization that we have developed by taking those inactivated virus vaccine last for 1 to 2 years. That is why vaccinations is very important. Okay, and there will be a question for you that is often asked in university exam, that is, why influenza virus vaccination development is very difficult. So answer is very simple, right? Due to the genetic variability, due to the genomic plasticity that promotes antigenic shift and antigenic drift, and that ultimately leads to the formation of new virus subtype. If the virus cannot develop new virus subtype, but there is a chance of mutation in the hemagglutinin or neuraminidase that we know as antigenic drift, right? So that is why annual immunization is very necessary, and that is the reason why flu vaccination is very difficult. Okay, so that was the last video for influenza virus infection. If you are taking this playlist as a from the point of view of medical microbiology, and if you are looking this video lectures as a series of virology, then please wait, I will upload another video where we will talk about the whole infection cycle of the influenza virus, how it will enter, how it will uncoat, how it will replicate, then how it will release from the infected cells. Okay, so that is the end of this video. So thank you for listening to this class.